And now on the line on Global Solidarity on Near FM is Breda Gahan, a Global Health Advisor with Concern Worldwide. Breda, welcome to the programme.
Thank you, Darren, and hello to all your listeners, and thanks for marking World AIDS Day 2021.
Okay, Breda, today is our 6th year in a row to cover World AIDS Day. I understand that this year's World AIDS Day is a bit significant more than usual for a couple of reasons. This is a pretty big question, Breda, but as this is our first interview in around 6 months, could you give me and our listeners on Near FM a bit of a summary, please, on your experience of the struggle to end AIDS over the years, and then tell us what World AIDS Day 2021 means to you?
Thanks, Darren. Yes, I can't believe it's coming up to the 1st of December and World AIDS Day, and really, I guess I first learned about World AIDS Day when it was recognised as a special day in 1988, and it's marked on the 1st of December every year, commemorating people who have lived with and people who sadly died with HIV and AIDS. For me, I remember, unfortunately, all the people who died from HIV and AIDS-related illnesses when I was actually working as a nurse. I'm a nurse midwife in St. James's Hospital in the late 1980s, and especially before we had treatments. A very sad time, Darren. I mean, everybody died. We had no treatments. We supported people to live as positively as we could, but everybody ultimately died. And the people affected at that time were people who had used drugs. Heroin was a big drug in Dublin City at the time. Men with haemophilia, I don't know if you know that one, an inherited bleeding disorder in which the blood does not clot properly, and the factor VIII imported from the US unfortunately infected these young men. And gay men, some women too. And it was very hard to nurse people with an illness at the time that had no cure. Thankfully, this has changed a lot with medication, and living with HIV is very manageable in Ireland now and in many countries. It is not so easy, however, in poorest countries where Concern is working. And in 2020, last year's data, still over 25%, in fact 27% of people living with HIV were not able to access treatment due to the lack of medication in country or the poor health systems delivering the medications. And as we all know, even in Ireland, HIV testing and treatment services were seriously interrupted in the early days of the COVID-19 pandemic in 2020, including here in Ireland. So things are improving in northern countries, but there's still work to do in southern countries. And every year there's a special theme for World AIDS Day. And the theme, I think, of the first World AIDS Day was, in 1988, this was, A World United Against AIDS. The theme now in 2021, linking to the COVID-19 pandemic, is End Inequalities, End AIDS, and End Pandemics. And people all around the world try to show their support for people living with and affected by HIV, because we must remember the mothers, the fathers, the brothers, the sisters, the work colleagues, the people directly affected when somebody is living with HIV. And I think it was 1991 when many people, you can't see me today, Darren, but many people wear a red ribbon in solidarity and to raise awareness for people living with and affected by HIV.
And this year marks 40 years, doesn't it, of when AIDS was first identified as an illness, isn't it?
Absolutely, 40 years. It's hard to believe. It's 40 years since 1981, yes. And there's almost no country in the world now untouched. Countries for Concern is working with Irish Aid also. We'll all be marking events and with host ministries of health, partner organisations, where we're working literally from Afghanistan to South Sudan and Sudan. It's an important day to highlight that HIV is not over, and in 2020 the data tells us that 37.7, almost 38 million people are living with HIV globally today. 53% are women. So more women than men infected living currently. And every week, 5,000 young women aged between 15 and 24 become infected with HIV. At 40 years on, I say, women and girls are most impacted. And I would say that the face of HIV in 2021 is an adolescent girl who has often limited access to education, services, testing, due to violence against women and other issues in countries where concern is working. Their risk and vulnerability is higher. So over 4,500 adolescent girls become infected with HIV every week. So a lot more to do in terms of reducing the inequalities that contribute to risk and vulnerability, which supports transmission of HIV.
Okay, we'll come back to the Global South again in a few minutes. I was born in 1981, 40 years ago, and I first heard of AIDS in what would have been the late 1980s. And I remember even in a lot of the 1990s when I was a teenager that the label or stigma of having HIV/AIDS was such that having the illness was seen as a death sentence. The change in the state of affairs in Ireland and in a lot of countries, I think, Breda, is amazing. Do you?
Well, yes, Darren. With education, outreach work, available treatments, and increased understanding on how HIV is transmitted, how it's not transmitted, stigma has thankfully been reducing in most countries. Like I mentioned, Concern through Irish Aid funding has been supporting responses in countries like Liberia and Sierra Leone in West Africa, where messages on stigma and HIV testing education is promoted, just like you're doing on Near FM through community radio and during outreach community sensitization campaigns. Reaching people in their locations is essential. And as Father Michael Kelly, rest him, used to say, education is the social vaccine. The people being left behind, unfortunately, even still in 2021, are key populations whose rights are not often realized. And these include sex workers, people who inject drugs, prisoners, transgender people, gay men, men who have sex with men. Like I said, they're not always protected in terms of their rights, and their access to testing and treatment can be very challenging for them. So advocacy on this, in terms of human rights perspective, for Concern and Irish Aid is really important, working on it in the countries with the ministries of health and governments where we're operational, and globally. And here in Ireland, we've Irish organisations like ACT UP, HIV Ireland, GOSH in the West, Cork Services, and AIDS West. So people are assets, education also. Different organisations are supporting to continue to reduce stigma and discrimination, because without access to treatment, a person unknowingly can transmit the virus to other people. So the best solution is to support people to have early testing and early treatment. And with effective treatment now, a person living with HIV can become what's known as undetectable. They have an undetectable viral load of HIV, means they cannot pass HIV onto their sexual partner.
Okay.
Young women as well, like I said, and adolescents, they still have many factors, especially in more conservative countries, in terms of even trying to go for a test. And the theme for this year's World AIDS Day is very apt, I would say, to end inequalities, especially gender inequality, to help to end AIDS and end pandemics.
Okay, and only yesterday on Tuesday, UNAIDS released a big report, didn't they? Can you tell me a bit more about what was in it?
Yes, the title of the latest report is, like I said, Ending Inequalities, Ending Pandemics. And in fact, they issue a stark warning that if leaders fail to tackle the inequalities, the world could face 7.7 million AIDS-related deaths over the next 10 years. Investment needs to be continued to support HIV prevention programs, outreach, testing and treatment. 37.7 million people living with HIV, with over 5,000 infected every day. HIV is technically 100% preventable. We need to invest more to prevent AIDS, and with the COVID pandemic ongoing and the interruption of services, this will be challenging going into 2022, I would say. And, we're all still aiming for the target, SDG 3, in terms of health, to end the epidemic of AIDS, HIV and AIDS locally and globally by 2030. Am I right? That's just 8 years left to do that.
Yeah. Okay. The Father Michael Kelly lecture is coming up in a couple of days, I believe. Also, the lecture will be over by the time our interview today is broadcast on Near FM, Breda. But could you tell me a bit more about this year's lecture?
Yes, and it will be recorded. It will be, people can sign up for it on the website or through Twitter. So it's on Friday the 3rd of December between 1 and 3 p.m. Irish time. It's a live web event. And the title this year, in recognition of Father Michael Kelly's work, he was an advocate, a teacher, a professor in Zambia, and his great mantra, like I said, was education is the social vaccine. And in honour of him, the focus is on continuing to acknowledge what he has been doing and to support end to stigma and discrimination. The keynote speaker is the UNAIDS Executive Director, Winnie Bayanima. Minister of State for Overseas Development, Colin Brophy, will be speaking. Professor Sheila Toulouse, the co-chair of the Global HIV and AIDS Prevention Transmission, Alva Smith, an activist here in Ireland, and Liz Martin, a woman living positively with HIV and an AIDS activist here in Ireland. And it will all be moderated by Dale Vickham-Singer. So go on to the Irish Global Health Network website or Irish Aid, and anybody can register, obviously, for free to join the important special event happening 2 days after World AIDS Day on Friday, December 3rd, between 1 and 3 p.m. Irish time.
That's going to be on Zoom, is it?
I think it's Zoom, yeah.
Okay, Breda, I won't keep you much longer. I read the UNAIDS fact sheet for 2021 you sent me last week. I find it remarkable that the extra funding needed to get on track over the next few years to end AIDS is not an insurmountable figure. I thought we needed like tens of billions extra, but I don't think it's that high, isn't it?
It's certainly an investment that's well warranted in terms of the bigger costs, the costs of prevention compared to the costs of treatment. It's a no-brainer. Prevention is better than cure for every illness, including COVID-19, as we're learning today. If somebody becomes seriously ill with COVID, they can end up in intensive care, and it's impacting on delivery of other essential services and operations, including in the Mater Hospital down the road here, where I trained in affecting planned transplant surgery. So any infectious disease, is better prevented, and the investment in education for prevention and testing is totally cost effective when one considers the costs of treatment for life. Antiretrovirals don't come cheap, and they need to be delivered to all the countries where people are living with HIV, including here in Ireland. They're free, but ultimately the taxpayer, the government is paying. So it's absolutely essential that investment is secured to end AIDS and HIV transmission by 2030. We know we can do it. We know how to stop HIV. And the good news is I've been looking up the statistics in all the countries where concern is working, and thankfully the prevalence figures, the numbers of people living, are decreasing slightly, from high prevalence countries like Malawi, 8.1%, so, almost 1 in 10 adults is living with HIV. to countries like Kenya, Haiti, Rwanda, Sierra Leone, Sudan, South Sudan, between 1 and 5%. So we are slowly moving in the right direction, but more can be done. Any chronic illness for an individual, even post-COVID or long COVID as it's being called, is a nuisance and a disability for people who are trying to lead full and fulsome lives. Yeah, well, the last thing I want to end on a positive point, I suppose. I've been working with Concern for 33 years now, much of it living in and supporting work in Africa, the world's largest, second largest and most populous continent with 54 countries. People in Africa are increasingly taking actions to reduce risk and vulnerability. They know it can be prevented. Our job is to support them to help reduce transmission, and HIV, as well as being human immunodeficiency virus, stands for Hope is Vital. So I hope your listeners, Darren, and everybody listening in can continue to support the HIV and AIDS response locally and globally here in Ireland and in the countries where Concern is working until we can reach that target of ending the epidemic of AIDS by 2030. Thanks a lot for your interest, Darren, and good luck with your work.